I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
Good morning, Dr. Lebo, Gyno, Sunday morning. 32-year-old from Oregon State who flew to me for his concerns and treatment of his gynecomastia. Now, when I saw him yesterday afternoon, he just ran from the airport, and he was all tense and everything, getting here in time for I can see him. And the nipples were shriveled a bit, and I was saying, what am I doing? And I was going to do a little lipo, but now he's more relaxed. He's coming in here. And let me show you how things can look normal if you touch the nipple. So if I bring him up here and start to kind of pound this nipple here, you're going to see it contract, stiffen up, goosebumps. See you getting the goosebumps right there? And that's normal. That tells me that, see how it's, give it a flick. See how that's relaxed and that one's getting the goosebumps and it's tightening up, and it looks way better. This is normal with gyno. See the goosebumps and see it shrivels up, tightens up, that's normal. But when he's relaxed, and it's been bothering him since his teenage years, we're going to take care of it under local anesthesia, stealth incision where the water meets the beach. We're going to get this gland out to perfection. When I'm in there, I'll also contour the fat of the chest. Glands have the body, the head, and the tail. This guy has a lot of a tail on this side. This side, I think the left side's a little smaller, correct?
Yes.
Yep. So local anesthesia, see that looks normal? And I can do the same thing there. I can pound that one, and same thing. It'll get the goosebumps and tighten up, and that's normal. And that's why some people, before they go out on a date, they kind of go bump, 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 and it makes their chest look good. Or before they go on the beach or whatever. See, that one's tightening up. It's the way it is. It looks normal when it's stimulated, and it's when he's got some beers in him, or he comes out of a shower, or he's on the beach with some beers in him, or some pina coladas. They look not so good. So all that said, let's go. I marked them. This is the gland. That's the pec muscle. That's the midline. That's the median. I'm going to numb the up here. Make a stealth. Stealth incision where the water meets the beach. Good. And done. Easy peasy. Let's go.
Hello, let us begin by introducing ourselves. I am Han.
I'm Franz.
And we want to pop you up.
Yeah, with all my stuff, it doesn't bleed.
So you're already making the cuts?
They're already made.
No.
She's futzing. All right, so I'm making my cut, making my little flap here, it's called, to see how thick I want the nipple to be. Got to get out, most of the glands, if not all, 99% of it. Otherwise, if you leave much of it in there, it grows back. And there's the gland. I see it very nicely, actually.
So if you leave some of it, it goes back.
Absolutely.
You know?
Absolutely. And he's got a little fat going on here. Not much. So I trimmed that away. That one right there. Trim some of the fat because I want to see the gland. So the fat's yellow. And the gland is blanco. Gland is amarillo.
Amarillo.
Amarillo. And the gland right there is blanco, it's white. So I want, I kind of, otherwise I can, if you do that, I can buttonhole. Nice. So now I follow the white down, get rid of the yellow, really kind of. Nobody does this procedure like me. Most of them just kind of gouge. So with me, I just, and with the tumescent, it's so nice because it's like, you know, literally bloodless. You know, put the tranexamic acid, it's on all those meds. So that's the body of it right here. And the head of it is right there. Not much of it going over there, but the tail goes, there is, and that goes up into the armpit a bit. Not terrible. And as you can see, I'm far away from the that's the muscle right there. Not invading that, not touching that. Yeah, that's the gland.
It is, wow, for 10 years.
It's like little pieces of gland
that you remove.
kind of left in there, you know. And I look at the fat, you know, make sure that it's nice and perfect. Nice. Good, come up over here. Look over here. Good. Nice. And then, oh, you're so good. In there. And that's the fascia.
Yeah, that's
See,
the fascia.
that I don't want to touch.
Yeah,
That I want to leave alone.
Yeah.
You know, it's nice and, you know,
Yes.
once you, if you invade that fascia, then you can get the nipple stuck
Yep.
to it and, you know, to the muscle. And, you know, that's bad. Okay, come on out. That's muy mal. This is beautiful. Thickness of that nipple is great. All right, we're about done. We're not going to close it, so what I do now, same thing. Nice. Good. Yeah, give me that one.
Good.
Perfect. All right, so now I'm gonna make where the water meets the beach on the other side. So I can see the gland. I think this side's gonna be a tad smaller, but you can already see the whiteness. See right there? Kind of pops out like a little,
Yeah.
the way I do it.
Yes. I've been seeing it different ways too. That's one. But you actually get the whole gland.
I get the whole gland and not in pieces.
Yeah, exactly.
Not in pieces. Let me have a little wet one. I like my
Like what?
wet one. I like my hands to be. I hate when people are in videos and they're they got like blood on their hands. Yeah. All right, so now I go underneath here. Yeah, so what I do now, I see how thick I want it. So I cut it from a little tougher because I'm righty.
Yeah.
So it's a little tougher on the left side. But I kind of put down so I can see exactly, with my pressure, how thick I want the, and then I flip the nip and I make it, into whatever I want. Good. Nice. Okay. Now give that back to you. Yeah. And now I get the yellow. See, that's the gland right there. So now here, same thing. Leave the fat alone, or save the fat. That we can address later. And I like to scrape it, grab it, scrape it. Chitlins. And this is going to dive down to the tail again. Lift up your arm just a little bit. Thank you, sir. And there's the body. How old is she? Oh, she's a big girl. She's big. We call them pulkies. Pokies? Her thighs?
Yeah.
I call them pulkies. Her thighs are, she's got bigger thighs than you. They slim down. They slim down.
Yeah, I know. My kids were like that. Like,
Big thighs and
wrinkles, the wrinkles. Oh
wrinkles.
Oh my God, I love it.
No wrist. They're whole. They're no wrist. They got cankles.
Yeah. Yeah. Especially Danny, my last one, oh my god.
He was a big boy?
Yeah, and I love it. Like, oh. I always grabbing his cheeks. Now he's so skinny.
Now he's... So now what I'm doing is I'm cauterizing any blood vessels and also strengthening the back, dehydrating the back to make it palatable. Good morning, Dr. Lebo. Lebo Gyno finishing product here, bilateral gynecomastia gland removal, 32-year-old from Oregon State. Local anesthesia, got the glands out to perfection. Here they are right there. They're going to be sent out to pathology just to make sure they're nothing bad, but let me tell you, they are nothing. Just make sure you didn't get the name of it on the thing. So stealth incision where the water meets the beach, local anesthesia, got him out to perfection. He's swollen around there. This was local, so I gave him tumescent, which is a lot of local to numb it up. And that makes it perfect. No bleeding, nothing. It's just amazing the way I do it. So if you have gynecomastia, you call me Dr. Lebo. Lebo Gyno and beyond. 631-424-0101 or email me at jonathanlebowitzmd@gmail.com. Let's go.